Hello, everyone. I am Patty Couture, and I would like to welcome you to this week's podcast featuring ethics in nursing. This seems a fitting topic for discussion this week as we head into the week of remembrance. This week, we will continue our learning journey with a focus on ethics, ethical care, and ethical frameworks in nursing theory development. This presentation includes definitions on ethics, bioethics, and ethical inquiry. It will examine the virtues within professional nursing practice. It will review why ethics is important in nursing practice and examine a few ethical codes of conduct. It will highlight moral development and moral development within theory. It will overview the traditional view, theory view, and pluralist view. And throughout the presentation, we will connect ethics in nursing theory to nursing practice. So what is ethics? Ethics is a discipline, as it has a specific body of knowledge. It involves autonomy and is based on value dimensions. It is a unique field of inquiry and includes patterns of knowing. Harper's 1978 Patterns of Knowing include the components of moral knowledge in nursing. Ethical patterns of knowing requires experiential knowledge of social values and ethical reasoning. It focuses on matters of obligation, like what ought to be done, differentiating from what is right and what is wrong. It is inclusive of taking responsibility for the decisions you make. It includes codes of conduct and ethical codes in nursing, such as confronting, resolving, and conflicting values, norms, principles, and interest in understanding philosophical positions. These include consensualism, social justice, and deontology. Nursing ethics has not yet had the authority within our position as the value on science has.
What is bioethics? Bioethics is the field of study concerned with ethics and philosophical implications of certain biological and medical procedures, technologies, and treatments. This could include things such as organ transplants, genetic engineering, and care of the terminally ill. Applied ethics involves examining specific controversial issues in health. This can include such things as abortions or even assisted suicide. Ethical practice is built on five main virtues. Nursing professionals have the responsibility of being altruistic. This means that we have the obligation to serve others without self interest. It is deeply rooted in the act of caring. This is beneficence. Autonomy is self regulation. It's how one conducts themselves within their practice. Putting the patient's safety first and conducting the practice of nursing without intent to harm is non maleficence. This also includes taking care of yourself, being the best that you can be in order to take care of others. Nurses' obligation to strive towards providing the best results possible in any given situation. Seeking truth and following best practice is consensualism. Justice is the foundation to nursing. It's telling the truth and being accountable for all your actions. Ethical inquiry. Ethical inquiry is a focused reflection on an individual and professional bias. It must be done prior to designing a conceptual framework, eliminating the chance for ethical implications. Ethical inquiry examines both inter and extra personal factors. Interpersonal factors include things like worldviews, professional and personal experiences. Extrapersonal factors are historical content or the influence placed on others during a given time frame. These factors influence the motives and purposes of one's conceptual frame. As exemplified by Reid on page 5 of her 1989 writing, she examines the decrement model of human aging, providing us with the influence that the conceptual frame may be swayed by bias. A narrow ontogenic scope formed the conceptual frame, thus any further research efforts developed in support of this theory be seen by others as unethical. Now let's go over some historical overviews of ethics in nursing. The International Council of Nurses Code of Ethics for Nurses was most recently revised in 2012. It is a guide for action based on social values and needs. The code has served as the standard for nurses worldwide since it was first adopted in 1953. The ICN is a federation of more than 130 national nurses associations, representing the millions of nurses worldwide. Operated by nurses and leading nursing internationally, the ICN works to ensure quality care for all and sound health policies globally. Further review, Code of Ethics. The Code of Ethics is a fundamental document for any profession. It provides a social contract with the society served, as well as ethical and legal guidance to all members within the profession. I placed this slide here to highlight the American Nurses Association as it proclaims 2015 as the year emphasizing nursing ethics. It'll be interesting to discover if that impacts research and theory development relating to nursing ethics in 2015 or further, as it is spotlighted within the association. Ethics in nursing, philosophical positions. Consensualism, the theory by which an action is considered right or wrong depending on whether its outcome is good or bad. Deontology, or duty, the theory or study of moral obligation. Social justice, highlights the distribution of wealth, opportunity, and privilege within a society applicable in human, social, science, and educational services. Best nursing relies on dedication to excellence across the domains of practice. It is exemplified by a high degree of competence, exemplary performance, and an authentic reliance on ethical and equivocal imperatives. It draws upon professional values and best practice and serves as a resource to drive transformational change. It involves ethics, social justice, leadership, research, nursing certifications, and nursing resources. This is Best Nursing from the Canadian Nurses Association. The Code of Ethics for Registered Nurses in Canada is developed by Canadian nurses for Canadian nurses. It is an outline for all nurses, including nurse leaders, nurse researchers, and nurse theorists. It assists in guiding their behavioral ethically as professionals. It provides an overarching formula for nursing decisions when nurses encounter barriers preventing them from fulfilling their professional obligations. The codes can support nurses in their practice and reduce their moral distress. Ethics in nursing is something which encompasses individual interpretation. It is based on individuals' morals and values. So although the Code of Ethics and nursing practice guidelines assist us as nurses, they do not absolve us as nurses from making appropriate individual decisions. This is why we always must be reflective in our work, asking ourselves, is this the right thing to do?
Moral development. Moral development's approach is empirical. We know this because nursing ethics includes ethics research. Ethics research is a developing field of inquiry that combines theoretical reflection with empirical research. Moral development's overarching norm is autonomy. For nurses to advance in the discipline of nursing through theory, they must do so by incorporating moral development. It includes looking at what's best for the wellness of the individual, family, or group. Ethics of care or moral values differ. Clarifying one's ontology, values, beliefs, biases, and goals must occur during conceptualization of research and during the research project. You must find your own voice, your moral compass. Moral development helps guide nurses from clinically expert nurses to becoming nurses with voice and action that actively participate and do not deflect difficult issues onto others. What is the true voice and experience for nursing practice? Moral development and nursing theory. Nursing theory is an ethical endeavor that involves complex nursing knowledge as it directly affects human life and human life transitions. Theory is based upon value choices and beliefs about human beings, and these can influence the good of society and its overall health. Currently, there is no clear distinction between cognitive and normative knowledge within nursing theory. This is particularly true as it applies to the inseparation of ethical reasoning and clinical judgment. It seems one potentially carves the direction for the other. Nursing includes ethics research. There are three areas of development in ethics research. Traditional views. Traditional views share ethical views with other disciplines. This includes overlapping areas of interest. These areas could include whistleblowing, advocacy, overtime, and staffing patterns. Pluralist view. Pluralist view does not discount ethical frameworks from alternate professional perspectives, but it does not rely solely on them either. It is about the quality of the decision-making process. It has the advantage of drawing from the academic resources of many theories, while still opening to specific moral concepts, critical reflections, moral understanding, and moral imagination. What could have happened? What if? How come? Why? Theory view. Theory view is rooted in nursing-specific philosophical approaches, so it is seen as particularly well suited to explicit nursing interests with specified nursing focus. Unlike bioethical models that are generalized and acceptable concepts, theory views look at historical trends of important concepts to nurses, such as accountability, cooperation, and caring, with an emphasis on care. Theory view includes virtue ethics, care ethics, narrative ethics, and feminist ethics. This draws me to the conclusion of my PowerPoint presentation on ethics in nursing. I do hope you enjoyed it. I leave you with a reflective quote for the week from Maya Angelou. It is one of my favorites. Do the best you can until you know better. Then when you know better, do better. I hope you have a wonderful week. Let's not forget to give credit where credit is due. The next three slides hold the references that were utilized in the creation of this PowerPoint.